When you're in the hospital, it's a lot. There's a lot going on. There's a lot going on when your child's in a procedure. It's a lot going on day to day. And I found that I wanted my focus to be on Hudson and on what his medical team was telling me so that I could make the best decisions for him. We very early on decided my husband would be the contact person for our family and friends, and I would be managing all the hospital stuff. So the only person I really had to tell was my husband, and then he would send the information out to our friends that we were keeping sort of up to date, which was not all of our friends, and also our family members. So he had chats for both, and he would update them with what was going on. I divorced myself from having to deal with other people's emotions because I just didn't have the mental capacity to do that. I had enough on my plate, and I had to choose what item I could let go so that I could do my best job to be the best advocate and mom for Hudson while we were in the hospital.
Setting boundaries can be really tough with family and friends, but it's really important from the outset that they know where you're at and they know how things are going to be in terms of communication. The really close family and friends we communicated with a bit more. We started an email list and we kind of just said, when we have news to share, we'll share it. Because this is about your family, this is about your child, and if you need to put your phone down for a week or a month, you can do that. No one gets to write this story except you.
So Claire had open heart surgery to repair the ventricular septal defect. We were fortunate that we've been at the hospital for a year prior to leading up to the surgery. So Claire had had the benefits of working with Child Life the entire year. So we had like a real ally at the hospital that Claire was super comfortable with. And so leading into the few days before surgery, Child Life was certainly able to kind of help translate or provide us tips on how to talk to our child. So the surgeon would say, this is what you can expect, or the nurse or the cardiologist, etc. And then we would turn to Child Life to say, how do we tell this to Claire? And then they would say, this is what you're going to say, this is what we're going to do it together. And so I really felt like we were in it together, which was really helpful. And we definitely utilized that resource all the way until the moment we were walking into the OR. The other thing is really having these open conversations at home. So we were trying to continue to answer questions, be honest, but do it in a sort of an age-appropriate way.
We are very careful about our language, so we call things what they are. We do try to give him age-appropriate information, and we always have. So even when he probably had no understanding whatsoever because he was a very small infant, we still would talk about it openly in front of him. So it became the norm to do that.
When you go through the consent procedure before a surgery or an operation, it can seem very overwhelming. The doctor is going to go through all of the risks and all of the potential complications. Taking that step back and remembering that you're in the right place, that you're in one of the best children's hospitals in the entire world, trust is going to be huge. It's going to be really, really important to get you through this. They're going to read a lot of scary things off that list of things that could happen to your child. It's okay to be scared at all those big words when they bring up mortality rates. That's going to happen. If you feel guilty because you're like, well, that means I don't trust the doctors. No, that just means you need some time because you're just hearing all of this stuff for the first time. If they run through it quickly or they say just sign here and you're not comfortable with that, take the time. Say, can I read this entire sheet, or can you read this entire sheet to me slowly? And they will. They'll do that.
So I felt really prepared going into surgery. I feel like we had a lot of the meetings, we'd met with Child Life. I felt really good about the day of surgery. Claire's surgery took longer than we expected. We were in the waiting room alone. It was a surgery that went through the night. And then at the end, the surgeon did come out and ask us to speak to us in a separate room. I wasn't really prepared for that. I think my mind went to the worst case scenario of like, why do we have to be in a separate room? This news must be bad. I mean, that's a very simple action that happened at the hospital that you maybe wouldn't be prepped for, but something that actually had a really big impact on sort of our emotional state in that moment. And of course unfortunately for us, it wasn't excellent news. It was a complicated surgery, but really the purpose of moving us to a separate room was for privacy, which completely makes sense, but just something I hadn't even thought of.
So when Hudson went in for his first surgery, which ended up being 12 and a half hours, I hadn't really even thought about what I was going to do for those 12 and a half hours. I had my laptop, I had the ability to watch Netflix and all of those things, but I really wasn't sure what I was going to do. And it was actually my sister who brought me paint by sticker, which I could do very easily in the waiting room on my lap. And I needed to focus enough to pick the right sticker and put it in the right spot, but it didn't require a great deal of thought. It required my attention, but it wasn't mentally challenging. Your thoughts are really with your child in the OR and with the doctors. You're not going to be able to give your attention to anything really strenuous, but you do need something to do that's not going to require a lot of mental capacity.
I think the other part about not being prepared was to actually see her after surgery. I wasn't prepared to see other children in the same room. I'm sure that we were told these things prior to, but there's a lot of information coming at a parent, and hearing it and seeing it in my mind were very different. The other thing is Claire was out of diapers at that point. She was just over 3 and they had a diaper on her, which again, for good reason, but just seeing her in a diaper made her feel and look so much smaller than I was expecting. Because her surgery was complicated, they weren't able to close her chest. They did say as we were sort of walking in that her chest had been tented with a cloth, a medical cloth, and to be prepared that it was opened underneath. I couldn't see anything, but even just the fact that it was opened beneath the cloth was something I just really wasn't prepared to hear. I think in the prep for our surgery, maybe it wasn't something that we talked about because it wasn't an outcome that they were expecting. But that was just something that I found really alarming. I think the environment of the CCU is sterile. There's a lot of machines and cords and all the drugs, and I felt really overwhelmed. And any amount of preparation that you do before experiencing that is just an entirely different thing. So I think maybe talking to other parents, seeing something like this, even just like searching videos of what a CCU looks like. You could ask your NP or child life to have it to be able to see what it looks like, or even have it described to you. What will it look like? What will my child look like?
Leading your child in for surgery is one thing. They look a certain way, they're acting a certain way, and then you go into a waiting room for a long time, and then you see them afterwards, and everything has changed. The child that you expected to see, quite honestly, is not there. Knowing that they're gonna look different, that they're gonna act different, that you might not be able to hear their voice, and there's a breathing tube in there, and you might not be able to see their eyes, and they won't be smiling. Our son looked a little cross-eyed for a few days when he was able to open his eyes, and that was devastating. It sounded so silly, but we said, are his eyes gonna go back to normal? They reassured us and they said, yeah, this is just the way it goes, but we didn't expect that. We said, who's this kid who's all puffy and who isn't looking at us straight on? And it didn't feel like it was him. But you really just have to lean on that healthcare team. Those nurses are gonna be there, they're gonna be incredible. They're gonna explain everything that's going on. It sounds weird, but you will get used to it.
So one of the things that I found a little overwhelming during our stay in the CCU was rounds. I found it a bit uncomfortable listening to them talk about my child but not being involved in the conversation. The way that my husband and I kind of mitigated this was to log all of our questions during the conversation and bring those back to our NP. She was excellent at being open to say any questions that come up, anything you're confused about, if you want information on the drugs they're talking about, the next steps, anything, just ask. And I would say the cardiologist was also very open to questions, but there was a time and a place, and I completely understood that that wasn't the place. But being able to know that I could have my questions answered based on what I heard was really reassuring.
In terms of friends and family, something that's really hard to do is saying yes when they offer help. And that's so tough because you think, well, I'm not just gonna ask you to do something. The flip side to that is you could come up with a list preemptively of things you might know that you'll need help with. And when someone asks and you think, I don't know what to say. Just go to the list and say, we could use some groceries, or we could use this Starbucks gift card. It feels really awkward when money comes into play and people's time, but they're offering for a reason. Because at the start of it, you'll think you're okay, and you'll think you're fine, and you'll be able to get the laundry done, and you'll be able to look after the house, and you'll have enough money. But then time will creep on, and you'll be here longer than you expected, and some of those administrative tasks are gonna add up. Your bank account is gonna start to go down, and you're gonna need that help. Just take it.